Hello, everybody, and this lecture is mainly for physical therapists and for professionals who are working in exercise prescription. When you go to a physician, physicians prescribe some medications, and we take this medication with certain dose, certain frequency, like I'm taking this medication 10 milligrams, 2 tablets per day, 1 tablet per day, and so on. So for us as a physical therapist, we prescribe exercise for our patients, and every patient differs from other patients. That's why I will be talking in a series of lectures about exercise prescription, how we can do exercise prescription, how we can do exercise testing, what are the difference between different populations like normal healthy individuals from those who have cardiac problems and so on. So let's start together. Exercise testing. Exercise testing continues to be the single most important non-invasive procedure used in the diagnosis and management of patients with coronary artery disease. Although exercise testing alone is less sensitive and specific for women versus men. Okay, so people with coronary artery disease, usually we prescribe some exercise intervention for them. Originally, exercise testing was used to measure functional capacity or to evaluate abnormalities of coronary circulation. We are using that just to test functional capacity. Currently, exercise testing is used for a variety of patient management problem that is listed in books 10.1, which we will be seeing now. So indications for exercise testing or exercise stress testing include evaluation of chest pain suggestive of coronary disease, evaluation of atypical chest pain, determination of prognosis and severity of coronary artery disease, evaluation of the effects of medical or surgical therapy or intervention, evaluation of arrhythmia, evaluation of hypertension with activity, assessment of functional capacity, screening to provide an exercise prescription, provide motivation for a lifestyle change to reduce the risk of developing coronary artery disease. So as you see, we have a wide range of indications for exercise testing. Exercise testing, I'm trying to establish the base. Okay, so later on, if there are intervention or exercise program or anything happening, we will see the effect of this intervention depending on the comparison for the baseline. So this is what's meant by exercise testing. Currently, exercise testing is used, as we said. Exercise testing involves systematically and progressively increasing the oxygen demand and evaluating the response to increase demand. Okay, the technique varies with different modes of exercise chosen and different protocols used by the examiner. Formal exercise testing involves the following modes of exercise. Okay, the heart is a pump which is pumping blood to the whole body, and this blood should be oxygenated. Okay, and we are trying to increase the demand or the stress on the heart muscle and to see if there will be any ability to meet this oxygen demand on or not. So it says figure 10. Okay, this is a patient performing an exercise stress test. As you see, this patient is doing this exercise test on a treadmill. However, the stress test could be also done on a bike or different, instruments, as we will see together. And there are different measurements we are using, like sphygmomanometer to check blood pressure, 12 lead ECG electrodes to see what is the EKG or the ECG tracing for the patient, resuscitation cart and defibrillator, just in case the patient went into any complication or severe arrhythmia or even arrested during exercise. And through this screen, we can see the ECG monitoring and controls to see if there is any change to, the EKG or the ECG pattern of the patient during exercise. So it is a whole setup. It is not just walking on the treadmill without any prior arrangement. No, it is a whole setup. Okay. So here, the different modes of exercise, this patient or this healthy individual is doing that on a treadmill, but we have also walking up and down steps, exercising on a stationary bicycle, using arm or wheelchair ergometry, walking or jogging on a treadmill at variable speeds and inclines, because for the treadmill, you can increase and change the inclination and speed. And we will be talking about BROS protocol, which is involving different stages with different inclinations and different speed as well. Walking a specific distance as an in 6-minute walk test. Okay, and we will also explain what's meant by 6-minute walking test. Informal testing is performed to screen for exercise programs, sometimes on a group basis, and include such as a 12-minute walk, Cooper's 12-minute run, pulse recovery test, okay, or 1.5 mile run. These are informal testing. It is not a formal testing, but it gives us an idea about if the patient will be able to participate in exercise testing or not. Okay. So what's meant by maximal versus submaximal stress testing? The protocols that are used are described as either maximal or submaximal. The distinction or the difference between them is the termination point of the test. If I will let the patient reach to the maximum, or I will stop the test at a submaximal level. I will not reach to the maximum level. Submaximal tests are terminated on achievement of a predetermined end point unless symptom otherwise limit completion of the test. Unless the subject himself or herself tell you, okay, I feel some chest pain, I have some cramp, I feel so tired, I need to stop. So this is what's meant by symptoms terminated test or symptoms limit for completion of the test. Okay, but some tests already have a predetermined level. Okay, I will reach to stage 3 and I will stop. Okay, at this, so I will not reach for the maximal level. The predetermined endpoint may be either the achievement of a certain percentage of the patient's age predicted maximum heart rate. The age predicted maximum heart rate is a simple formula. Like we subtract 220 minus, we subtract 220, okay, minus age, and so 220 minus age, this is the age predicted maximum heart rate. Somebody, his age is 40 years old, so the age predicted maximum heart rate is 220 minus 40 will be 180, okay, beat per minute or something like that, as this is a heart rate. Okay, there is another method which is called the Tanaka method, which is more accurate. Is 2.8 minus 0.7 times age. So for the same person who is 40 years old would be 2.8 minus 0.7 multiplied by age, and this will give us more accurate number than the the standard formula which are used for the age-predicted maximum heart rate. Okay, so here, maybe either achievement of a certain percentage of the patient's age predicted maximum heart rate. Like if I am telling you that we will reach for only 75% of the age predicted maximum heart rate. So for somebody, age predicted maximum heart rate is 180. You multiply 75% out of that, and this will be your predetermined level, where or when you will stop the test when the patient reach this level, okay, or of a certain workload. Like if I am saying 2.5 miles per hour, okay, and this is a speed on the treadmill, for example, and 12% grade. This is the inclination or the incline of the treadmill. A special subset of submaximal testing is low-level testing performed on patients during, the recuperative phase after myocardial injury or coronary bypass surgery. We know that for patients who already have or had cardiac complications, we should start at a low level testing. We should not reach for 75% and this high percentage. On the other hand, maximal stress tests usually use the end point, okay, of age predicted maximum heart rate, the maximum the patient can reach, or terminate when a patient is limited by symptoms. Maximal stress test is used to measure functional capacity and to diagnose coronary artery disease. Okay. The protocol for testing involves performing a progressive workload until the patient perceive an inability to continue because some limiting symptoms such as shortness of breath, leg fatigue, or chest discomfort. Gradually, I'm increasing the speed, I'm increasing the inclination until the patient reached to a certain level and said, okay, this is too much, I cannot, do more due to shortness of breath, leg cramp, or leg pain, or even, chest discomfort, like starting to have a chest pain. Exercise test also be described as intermittent or continuous. Intermittent testing spares progressive workloads with short rest periods to give the subject time to recover and decrease the effect of peripheral fatigue. So for the intermittent protocol, we will do testing for some time, give rest and for recovery, and then the patient will come back for the next stage of the testing. Okay. However, continuous tests usually incrementally, progressively increase the workloads until the test is terminated because of patient symptom or a defined endpoint. So now we have compared between a submaximal to a maximal test, and we are comparing also between intermittent versus continuous mode of exercise testing. We have stated the indications for exercise testing, and also at the same time the different modes or the different equipments we can use for exercise testing. Let's talk about low-level exercise testing. Why we are using low-level exercise testing? We are usually use low-level exercise testing for patients who already had, cardiac event like myocardial infarction, bypass graft, or anything like that. Low-level exercise testing is usually performed when patients have experienced and myocardial infarction recently or have undergone coronary artery bypass graft surgery. Such tests have been performed as early as 3 to 5 days after myocardial infarction or surgery. So post-operative or post-myocardial infarction, this low-level exercise testing will be done just shortly 3 or 5 days post the event which happened, but are more likely to be performed just before or immediately after discharge from the hospital following an acute event. Some physicians prefer to wait up to 2 weeks after the cardiac event before administering at the low-level exercise testing. So it is variable. Some people, they do this low-level exercise testing 3 to 5 days post myocardial infarction or post surgery. Some people will do this exercise testing when the patient is about to leave the hospital after acute care, and some physicians, they like to postpone that until 2 weeks already passed after the event or the surgery. Low-level exercise testing may be useful in predicting the subsequent course of an myocardial infarction or bypass surgery, as well as for identifying the high-risk patient. It gives me an idea about if the patient, because some people, they have myocardial infarction, and after some time they are at risk of getting another myocardial infarction. So this exercise testing or low-level exercise testing give you an idea about the course which the patient might have later on, okay, and identify patients who are at high risk of developing the same problem again. A test that has been gaining use enough is a 5-meter walk or gait speed test. It has been put forth as a possible predictor of risk in the cardiac surgical patient population. The 5-meter walk speed test has been used successfully in the geriatric population. High-risk patients exhibit an increased risk of complications or death as a result of myocardial ischemia or poor ventricular function. High-risk patients need more immediate intervention and should not be treated as typical patients in a cardiac rehabilitation program. After a high-risk patient is identified, the decision for optimal medical management or surgical intervention is more easily made. We have different categories of patients, as we discussed before. Healthy individual who is like participating in sport and just coming for exercise testing. Somebody who had myocardial infarction, cardiac surgery like bypass graft, and patients who are high risk cardiac patients who significantly and will most often will get some complications. And this book is suggesting that the 5-meter walk or speed test might be good low-level exercise testing for this population of patient. I would stop here, because I don't like, the lecture to be too long. But if you feel that this, lecture will be useful for you, please, I want to see that in your comments to continue. And I am planning to explain much of the cardiovascular and cardiopulmonary physical therapy, because this is one of the areas which we as physical therapists need to get more education on these courses or these subjects. So thank you for watching, and I will see you in the next video soon. Thank you.